double beating pulse. So the name itself gives you an explanation. It means there are two pulse waveforms in one beat. Okay. So what are the double beating pulse that you know of? So obviously people would have come across disvariance pulse. So that is one cause of double beating pulse. Then you would also heard of dichrotic pulse. That is also a double beating pulse. Okay. So carotid is the best place to feel for this character. Okay. So we'll first start with bisvariance pulse. So pulses, bisvariances, however you want to call bisvariance pulse, whatever. So this means the single pulse waveform with two peaks in systole. So this is the figure if you can see. So between S1 and S2 is the systole. So you see two peaks here, and then there is a dichrotic notch here, and then the dichrotic wave. Okay. So this is a single pulse wave with two peaks in systole. So best felt in carotid and best felt in brachial and femoral. This is what the textbook say, but we find it practically very easy to palpate in carotids. But when asked in exams, you should say it is best felt in brachial and femoral artery. So what can cause bisvariance pulse? Yeah, you all know it is severe AR. So mild AS with moderate to severe AR, that can also cause a bisvariance pulse. And HOCM, hypertrophic obstructive cardiomyopathy. So this can also cause bisvariance pulse. So we'll see what is the difference between the bisvariance pulse in aortic regurgitation and in HOCM. So why there are two peaks in systole? The first question. So the LV is ejecting, aortic valve is opened, and then the blood should go. No, why should be there two peaks? And if there are two peaks, why not in every other case? So this is explained by Bernoulli effect. So this is given, the references from Joule's constant again. So whenever you have this ejection of rapid jet, because the end diastolic volume is so high, okay, so you have so much of volume inside. So ejection of rapid jet of blood through the aortic valve. This happens because of ejection of rapid jet of blood through the aortic valve. During the peak flow, what happens is, because of Bernoulli's effect, Bernoulli's effect is nothing but a suction effect of the rapid flow over a surface. So that's general physics, okay? There is a suction effect. So this effect on the walls of the ascending aorta, wall of the ascending aorta, causes a sudden decrease in the lateral pressure, causes a sudden decrease in the lateral pressure on the inner aspect of the arterial wall. So once the LV starts contracting, first one gush of blood enters into the ascending aorta, and because of the Bernoulli's effect, there is some small aortic recoil, I would say. That's the suction effect because of this rapid gush of blood. This causes a decrease in the pressure on the inner aspect of the aorta, and then the second peak comes. So that is why there are two peaks in systole. So what is the spike and dome pattern? So spike and dome pattern is typically seen in HOCM. So typically seen in HOCM. Here there is a dynamic LVOT obstruction. Here there is a dynamic LVOT obstruction. So the ventricle tries to empties itself in the earlier systole rather than the late systole. Okay. So this preferential early systolic emptying, of the LV causes this spike and dome pattern. I'll show you the spike and dome pattern so that you can understand. So this is that spike and dome pattern. Spike and dome pattern that is seen. This is generally not palpated, it is only recorded. Okay, generally not palpated, it is only recorded. So if you look at the percussion wave, which is the early systole where maximum LV emptying happens, so that is which is a higher and sharper peak. And then the late systole, there is one more peak, that is smaller than the first peak. Okay? So this is the spike and this is the dome. So this is classically seen in HOCM, hypertrophic obstructive cardiomyopathy. So pulses bisvariance means 2 pulse in systole. So it can be seen in severe AR or mild AS with moderate AR or in HOCM. HOCM is specifically called as spike and dome pattern of pulse. This is because of a higher first peak and a smaller second peak. Okay, clear guys?